I'm Sarah Rebey. I am a physician assistant. I just passed my fourth year of practicing in neurosurgery, and I've been mentoring with ACDT for a year now. And today's presentation is going to be on becoming a PA, so the PA school blueprints. Essentially, every step-by-step process you need along the way in applying to PA school. So essentially, your blueprints involve coursework, your GPA, shadowing, volunteering and extracurriculars, patient care experience, and then the soft skills, such as your personality, interviewing skills, your writing skills that you say in your personal statement, all of that. No matter what, your top priority is your coursework when you're making up your mind to go to grad school, whether that's a PA or a PT, OT, doctor, what have you. Coursework is going to be the most important to begin with. Without the foundation of that, you can't even get an interview. So this should take priority early on before any other categories of the blueprints here. And then your second priority, kind of mixed in with everything else, is patient care hours. So unlike other professions, you usually do need patient care experience to apply to PA school, and we'll touch on that as we move forward. So step one is laying the foundation to become a competitive applicant. So take a deep breath. No matter what path you choose, the first 1 to 2 years of a plan to go to grad school are the same. Focus on your schooling and your grades. Getting through entry-level science courses is an important part of building a solid foundation in your medical understanding and even ensuring you want to pursue medicine. For non-traditional applicants, I still recommend focusing on taking remaining prerequisites and retaking courses you didn't do as well in first before prioritizing shadowing, volunteering, or even getting patient care experience. Before we move in, I had a couple hands raised. Is there any questions or issues seeing the presentation before I move forward? Okay, nothing in the chat box. I think we're good. Thank you. Okay, coursework and GPA. So most PA programs have a minimum GPA posted and a science GPA required to apply. Typically, this is a 3.0 minimum GPA. I have seen some programs that are 2.75 or 2.8, but that is more on the rare side. And then a science GPA tends to be in the 3.0 to 3.2 minimum range to apply to their program. On top of that, most of these programs will also post the average GPA or a range of admitted applicants to their program to kind of give you a guide on what competition is like to go to their school. So, for example, they might say their minimum is 3.0 for science and overall, but their admitted class was between a 3.6 and a 4.0, and their average science was 3.8. So sometimes using that as a caliber for if you can apply to a program or even giving it to yourself as a goal, like you want to go to that program so you know what GPA you need to achieve, is something to pay attention to early on. Without a strong GPA, your application might not even be reviewed or considered for interview. So if you're below the threshold of necessary GPA to apply, usually it will just get weeded out or sorted out and a human won't even look at it. However, if you meet the minimum, but say it's just barely over or it's a 3.1 and their minimum is 3.0, there's a chance your application is still reviewed holistically to look at all of your experiences, but you might not be considered for an interview. Or if you are considered for an interview, it might come down to them comparing you to another similar applicant, and the applicant with the stronger GPA is chosen. So you can understand how your prerequisite and your GPAs really mean a lot and why it is the main priority no matter what when considering to go to PA school. Creating a rough draft PA school wish list very early on is a good place to start in order to organize the courses necessary to apply and set a goal GPA that you're going to strive for. So even if you have no clue what state you want to go to school in, or even a program you'd be interested in, like you're starting from scratch, you could at least start with anywhere from 10 to 20 schools making an Excel sheet and compiling their GPA data. So you have a clear picture ahead of you, whether it's 1, 2, 3, or 4 years in advance that you're going to apply to PA school, you're aware of the number necessary. There's nothing worse than mentoring someone who is maybe a year away or in a current application year, and we calculate their GPA, or I go back and have them calculate their science GPA, and it's unfortunately too low to apply. So that can be really devastating, and you can avoid that by staying on top of it throughout your training. Common science prerequisites for PA school, they're very similar to medical school. So it's usually general chemistry, general biology, organic chemistry with a lab, biochemistry, microbiology and or genetics, anatomy with lab, physiology, sometimes with lab, medical terminology, sort of math course like statistics and psychology. Obviously, this is not all inclusive, but when you're making a wish list for your schools as well, you can note what prerequisites they require so that you can also make a list of classes that you need to get done before graduating, or if you're in a gap year, classes to go back and take in your gap year if it's a school that's really important to you. Next, we're going to talk about the framework. So this is everything that comes after the foundation of your classes. Like you have solid science GPA, you're doing well in your science courses, you enjoy what you've been learning. You're like, okay, I'm doing well enough that I can actually consider applying to grad school in healthcare. This is going to include extracurriculars, job shadowing, and patient care experience. So extracurriculars, I'm just gonna kind of bundle all of this together, including volunteering, intramurals, and hobbies. So volunteering is often encouraged, but not always required by programs. But choosing a philanthropic cause that matters to you is probably the most important part. So not just focusing on school and hours, but giving back to your community or being involved is still important when being a holistic applicant. I remind everyone of this that it does not need to be in healthcare. I think there's a misconception that you need to be volunteering in medicine for it to matter. And that is definitely not true. I'd much rather see an applicant who volunteered consistently with a cause that mattered to them. And you can be able to talk freely about it in your interview and why that was impactful or meaningful to you. So if that means that you are a pet lover and you just volunteered at a shelter all through college, that is perfect. You do not need to say, well, I don't have any volunteering in a hospital or medicine. That's not necessarily important. Next would be clubs, intramurals, sports. A great way to stay involved in your community or within your college community and connect with others with similar goals and interests. I know it looks pretty good if you, played a sport, no matter if it was D1 or if it was intramural, and you were able to, balance the curriculum, have a high GPA, and still be involved in other activities. An example of a club would be like pre-PA club. So that's a really good way to get resources like presentations like this. I definitely gave presentations similar to this when I was an undergraduate in pre-PA club. And then lastly, it's just having a hobby. So it's important to remain a person outside of your schooling and your interest in medicine. I remember how excited I was to become a PA, and I loved everything to do with medicine and healthcare. Loved Grey's Anatomy. It's just, of course, you're so excited to get into this career path. But it's definitely important, and retrospectively looking back on things, to build an identity outside of your career. It definitely can help with preventing burnout once you start practicing and having a healthy work-life balance. So maintaining a hobby and not solely focusing on becoming a PA through your training, I would definitely recommend. Okay, healthcare shadowing. So another misconception I think is that people think they only need to shadow PAs, and that's also not true. Some schools will require that you have PA shadowing. So that's an important thing to pay attention to when you're making your wish list, is if they require it or not. However, there is no bad shadowing hours to get, whether that's a physician, a PT, an OT, a nurse practitioner, a nurse, anything. The more time you spend looking at other healthcare professions can definitely help you determine, one, if PA is the right fit for you, and two, if you shadow other professions and realize that you actually kind of like them more, it might help you make up your decision-making process on if it's a good fit to move forward. So any healthcare provider is useful, not just PA. Oftentimes you could start shadowing and then you make connections. So for example, I think I shadowed a physician in the emergency department, and then I met some PAs through that shadowing shift who I connected with, got emails, and then was able to come back and shadow them. So Taking any shadowing opportunity is very important, not just the PA. Utilizing, of course, family connections, your own family doctor, and then looking through publicly available emails and LinkedIn profiles for providers in your area. Sometimes it does involve, cold calling or cold emailing a provider asking, but we were all in those same shoes. You have to find a way to shadow. So we understand it. I have had very many, emails out of the blue saying they found me online and asked if they could shadow. And I definitely welcome it because I struggled myself to get those hours. A tip I give to everybody is to utilize the holiday breaks and your semester breaks in between classes. It can be hard to shadow someone during the work week when you're obviously in school, usually full time Monday through Friday. It's not ideal to say, oh, can I shadow you for 2 hours this morning before class for 5 days, anything like that. So if you can find someone that you could consistently follow with for a few shifts or a week or two, I definitely would recommend that. On top of it, if you're looking for a letter of recommendation from a provider, the more time you spend with them, the more they get to know you and the better your letter of recommendation can be. Obviously, sometimes your hands are tied and it's difficult, and you end up asking a provider to write you a letter of recommendation. And you only shadowed them for 8 hours. You might just get a generic, very kind letter of recommendation, but it's not going to be glowing. So I just tell everybody, instead of maybe prioritizing 10 different providers to shadow with, if you could stick with one or two people consistently, I think in the end it will only benefit you. All right, here's the biggest hurdle. So most of the reason I am mentoring or people have joined advanced eClinical training, obviously, is to get a certificate for patient care hours. So it is the largest hurdle people face when applying to PA school because often there is a minimum number of hours required to apply. Now, I am seeing more schools that say that there is no minimum or that it is recommended. But if you want to have your picking of schools, definitely getting patient care hours is important. On top of that, I am really grateful for the patient care hours I got and the experiences I had prior to becoming a PA. Working as a CNA and a patient care tech really made me work from the bottom on the way up and respect my colleagues and the people I work with now. And it also gave me exposure to essentially the field I ended up working in. So when I was a patient care tech, it was on a neurosurgery med-surg unit. And I really liked that patient population and anything to do with that field, and ultimately ended up practicing it. So it's important just to maybe even try to get patient care hours in a specialty or field you could be interested to. The experience helps. So it's not just a hurdle that you need to check off, but something that can ultimately be very valuable in the end of your career. So step one is picking a healthcare job that counts. I say that because there are some programs that don't count certain things over another. It's hands-on patient care hours. Some people are allowed to put what's called healthcare hours on their application. If you maybe worked in a medical office, but you didn't directly, take vitals or interact with patients, that is different than patient care experience where you're a part of the care team, touching, administering medicine, talking to the patient. So some programs don't, for example, count scribing. So scribing can tend to be an easier job to get, but it's not always counted. So again, going back to that PA school wish list, paying attention to what's counted and what's not is an important thing as you make your decision on what job you want to get. Step two is usually getting trained and certified. So whether that's, doing a CNA course through your, local hospital, or maybe your hospital doesn't require certification and you're able to get a position, or you do need a certificate to get a job in the state or area you live in. That's finding courses online and picking something to, do on your own time to get that certificate. That's where advanced eClinical training comes in, where you're able to do like a certified medical assistant course at your own pace over the course of the year and take your state exam, and then you're able to get an MA job afterwards. Of course, you have to take into consideration how long it would take you to get that schooling done, and that you can't, if you take a whole year to do it and then look for a job, you've essentially wasted a whole year of time you could be getting patient care experience. So being very aware of how long it can take to get patient care hours is something that a lot of my mentees struggle with. So what I mean by that is part-time work, meaning 20 hours a week for 1 year, is only 1,000 patient care hours. When you're in undergrad, oftentimes it's not reasonable to work 20 hours a week. Maybe you only work one shift on the weekend. Maybe it's only a few hours on weeknights. So getting 1,000 hours or having a goal of 1,000 hours when you're 1 year away from CASPA opening maybe isn't realistic. Maybe you could only get 500 hours. So sometimes that leads to me saying, well, maybe you need to take a gap year to get more patient care experience because a lot of your schools require a minimum of 1,000 or a minimum of 500, and I don't think you're going to hit that goal. So again, planning, being aware of those minimum requirements can help you have a realistic timeline. So again, starting to work, maximizing weekends and school breaks, setting your goal number of hours based on the programs you're interested in, and then lastly, deciding if your application timeline is realistic with the numbers that you're going to have. Okay. Wiring together your knowledge and your skills. So this is where CASPA hasn't opened yet, but you're getting prepared to apply. CASPA opens every April. And so in the 6 months beforehand, you're going to be kind of gathering things together to be ready for the application cycle. The first one is letters of recommendation. Usually schools have requirements on who they want you to ask for letters of rec. Usually it's like a PA or a healthcare provider, a professor from your schooling, a manager, a supervisor in a job. So those are like three examples, or maybe someone you shadowed. So keeping in mind what their requirements are. Sometimes they have a minimum of 2 or 3 necessary. However, CASPA does allow you to add up to 5 letters of rec to your profile. So in my experience, I have told everybody to get 5 letters of rec. This is because there's nothing worse than someone ghosting you or changing their email, or maybe they've changed employment and you don't have their contact information, and suddenly you don't have enough letters of rec to apply that cycle. That can definitely lead to a panic, or you asking someone to write you a letter of rec last minute who doesn't know you very well, or maybe it's just not a very good letter of recommendation. So if you plan ahead to find 5 people to ask, the worst case scenario is you can't get a hold of one of them or 2 of them, and you still have 3 letters of rec. You can ask people for letters of recommendation all through your schooling. The important part is letting them know, hey, I am planning to apply to PA school in 2026 or 2027. Would you be willing to write a letter on my behalf, and I can contact you when that date comes closer? And then, of course, they say yes. You write this down, you put a reminder in your phone. When the time comes, you're emailing them a few months before CASPA opens and saying, hi, just a reminder, I was in your anatomy class. You had offered to write me a letter of recommendation, and I'm applying in April. Are you still willing to write my letter of recommendation? So you can ask people, of course, years in advance, keeping in mind that you need to remind them who you are, and making sure they do reply to you years later. So you don't necessarily need to be asking everyone for letters of rec within the 6 months before CASPA opens. You can do it in advance. Moving on to studying for and taking standardized tests. So the more common one required for PA school is the GRE, which is just the standard graduate exam used for many graduate programs, so not just to go to PA school. It's essentially like the SAT or the ACT of college, so it does not test your science knowledge or how you did in any of your undergraduate science courses. It's way more reading and math and comprehension skills. Based on how good of a self-studier you are, you could certainly buy a GRE book online and self-study for it. If you are someone who needs, a little bit more structure, there are GRE courses that you can sign up for. It does not take very long to study for, a few weeks to months, depending on your self-retention and self-pacing studying skills. So just keeping that in mind, you usually do not need to stress about the GRE until the year of applying. So you don't need to study for years. You don't need to take it years in advance, nothing of the sort. Some schools are not even requiring it anymore. So definitely if you're on the fence about taking it, just looking at your PA school wish list and seeing who requires it is helpful. The second one is the PA CAT, which is like the obvious physician assistant version of the MCAT to go to medical school. I have yet to see a school that requires it. I've seen some that recommend or considering it. And it's new enough that I actually don't know the details about the cost or studying for it or anything. As years come forward, if you're somebody who's planning to apply, 2, 3, 4, 5 years from now, This definitely is something that could become a bigger deal and even a requirement as time goes on. So kind of keeping in the back of your mind to pay attention to if a school is going to recommend the PA CAT and being in the loop with that. Obviously, if I tend to learn more about it or see that changing, it could be a presentation on itself about the PA CAT. Lastly is reviewing application costs and timeline. So application costs. In a general cycle, to submit your first application with CASPA, which is the central CASPA, or I'm sorry, the centralized PA school service. The first application is $184. After that, every program thereafter is $61. So that number tends to go up a couple dollars every year, not a ton. But if you're applying to 10 schools, I mean, that's almost $1,000 right there. On top of that, some schools make you pay for submitting your transcripts. You certainly can pay for a transcript entry service for them to do it for you. There's supplemental applications where a school could ask you to fill out more paperwork and charge you a fee. Then there's the cost with, flying, driving, and staying in a hotel for interviews. So in general, planning ahead to have those funds available is really important because you could easily spend $1,000, $2,000, $3,000 depending on how many schools you're going to be applying to. So setting some money aside and being prepared for the cost is important. Timeline is also important because there is not one universal opening and closing date to apply to PA school. Every program is their own entity. It is a little bit of a pain, I'll admit it, so staying on top of it is important. There's two types of deadlines, one being rolling admissions and one being deadline admissions. Rolling admissions is kind of what the descriptor sounds like. As they receive your applications, they review it and they offer interviews. So as they come in, they're doing something about it and they're extending invites and they're accepting students as they go. So you could easily apply to a school really quickly and they could get back to you a month later and you could have an interview a couple weeks later and know you're in PA school pretty fast. Then there's deadline admissions. That's where a school says, our deadline is December 1st of this year. That means from April to December, they are collecting applications, but they're not doing anything about it. Maybe they're reviewing them, but they are not extending any invites out to anybody. So in those schools, you have a, I guess, longer timeline that you could submit your application for. There's no rush. So when December 1st hits, then they're going to review, they're going to offer people interview dates. And then you might not find out till you're going to PA school until months later. So being really aware of if your wish list has rolling or deadline schools can help you triage how fast to get your application submitted because they're all submitted individually. You don't just click send to 10 schools. You can kind of say, okay, I'm going to submit my top 5 schools as quickly as possible because they're rolling admissions. And there is a school I'm interested in, but their deadline's October 1st. So maybe I'll wait a little bit longer and then I'll submit it when it gets closer. Okay, the finishing touches. So this is obviously filling out this CASPA application we've been referring to, having your personal statement ready, and then interviews for PA school. So CASPA is the portal you can go on to, and basically you're filling in all of your experience of why you're qualified to gain entry to PA school. Anybody can make an account with CASPA even on a year you're not applying. So if you want to make yourself familiar, you definitely can make an account even today, kind of see what the setup is, go through, see what fields are required for entry, what things look like, what schools profiles look like, that sort of thing, just familiarizing yourself. The CASPA application can take some time to fill out. So, it will open in April and then just you need to plan ahead for how much time it's going to take you to fill out your application as well. Another thing is that you have to send in your transcripts to CASPA and they verify that they're true and correct. So you could be completely ready to submit your CASPA application, but your transcripts are not verified yet. So that is a hurdle, keeping in mind to send in your transcripts and wait for that review process to be done until you can submit it. The next is the personal statement. I think everybody struggles with this. Obviously, for going into healthcare, not everybody is writing minded or creative writing minded. And the biggest struggle I see is people wanting to just reiterate their resume. It's very boring. And you do not stand out if every paragraph is just you saying, I volunteered here and I'm compassionate and I was a patient care experience and I was humbled by the care that was provided by PAs and blah, blah, blah. So Personal statement, again, that can be a whole presentation on itself and doing a personal statement. But the one thing I tell people who are preparing to go to PA school is open a Word doc and just word vomit into it every time you have some meaningful interaction, whether it's volunteering or working in a job or shadowing a PA, so that when the time comes to write your personal statement years from now, you go back to this document and you say, well, what can I use? What of these experiences do I want to write about and make like a vivid, attention grabbing personal statement. Obviously, you're going to want to have a rough draft. You're going to want somebody, a PA, a health advisor, a friend, to read over it and prepare for 2, 3, even 4 drafts before it's time to submit that. A side note is CASPA did create something called the life experiences section, which is new. So it didn't exist when I applied to PA school, but it started last year. It is a separate text box where you're able to talk about any challenges you had in your life that maybe impacted grades or patient care hours or anything you've had to overcome that you want the admissions panel to know about. This is really nice because I think a lot of the times people want to put their challenges in their personal statement while you're trying to answer the question, why do you want to be a PA? And it can kind of become a little discombobulated where you're trying to say, hey, I struggled with these grades because I had a sickness going on for a year. And I also want to be a PA for these reasons. So the nice thing about having 2 separate sections is you can have essentially a separate statement about your challenges and then still answer the question, why do you want to be a PA in your personal statement? And lastly, there's the interviews. So this is going to be how you carry yourself and how you come off to others and how well you articulate why you want to be a PA. Unfortunately, you could get through the whole process and have a wonderful CASPA application, a great GPA, a personal statement that got their attention. And when you get to interview days, you bomb it. So a lot of work goes into preparing for your interviews. You need to get comfortable being uncomfortable with questions and how you answer them, learning how to calm down and give a articulate response without your voice shaking or saying a ton of over again. So you need to practice with family and friends and either healthcare professionals for mock interviews when that time comes. Again, interviews themselves could be a separate presentation on the content of them, the structure, and how you can best prepare. But that is an equally as important part is you can do all the legwork and not do well on interview days. Lastly, and I just am making note of this, this was about how to get into PA school, but there is, once you're in, you need to do a lot to become a PA, right? So once you're in PA school, there's the didactic year, the clinical year, the PANCE exam, and then either fellowships or job interviews. Didactic year ranges from 12 to 16 months, depending on your program. Not all PA schools are the same lengths. I've seen PA schools that are 25 months, and I've seen some that are 36 months. So it depends. This usually equates to 3 or 4 semesters of full-time work. In your didactic year, you obviously have to pass all of your courses. And in PA school, often it's not like undergrad. You sometimes need a minimum of 80% to pass a class. Some schools have 70%, but you definitely can't have lower grades and make your way through without getting on academic probation. So the didactic year is challenging and rigorous, and there's a higher standard for passing grades. So you have to get through that too. The second is clinical year. This is the exciting part that everybody waits for with the hands-on experience where you rotate through specialties. PAEA, who is the accrediting body for PA school, requires rotations in family medicine, internal medicine, general surgery, peds, women's health, behavioral health, emergency medicine. And then electives are very common in your PA school for you to choose subspecialties or another field you're interested in. After each rotation, you are required to take an end of rotation exam called an EOR. And again, depending on your program, sometimes you need a minimum of a B or a C to pass that without having to remediate the rotation. Lastly is the PANCE exam. So this is our certifying national board exam. It's the C after PAC. When you're certified, you get this when you've passed the exam. It is a 300 question, 5-hour exam that costs $550. If you do not pass it on the first try, you have to wait 90 days to take it again. And then there's also a cap of how many times you can take it in a year. Paying attention to a school's profile of their PANCE exam rate is really PANCE exam pass rate, I'm sorry, is important, because if a school is really struggling with PANCE exam rates, it's usually an indicator they're not getting the education they need, or maybe the school is going to go on probation. So PANCE exam rate passes with a class is above 90% is a really good sign that you're going to go to a program that prepares you to pass this exam. Lastly, there's the post-grad decision making. It's becoming a little bit more popular to do post-grad fellowships where you do training for a year in a subspecialty field for reduced pay. Sometimes they're called post-grad training. Sometimes they use the word fellowship. Sometimes they use the word residency. I did a separate presentation on this that's on the ACT's YouTube channel if you want to learn more about post-grad training. And if you don't do post-grad, it's the job interviews. So if you're going to go straight into the workforce, you have to really be prepared for months after graduating of not having a job. It is not super common to have a job lined up the second you graduate. So being prepared with either money set aside or living circumstances so that you can interview for jobs and really choose the best position for you and not just taking the first thing that comes to the door. All right, we finally made it to questions. I saw you guys were submitting things as we go, so let me go from the top down. Okay, the first one is, do healthcare experience and patient care experience hours have to be finalized by the CASPA submitting time or pre-app deadline? Great question. So if it's a rolling deadline school and you're in a rush to submit, the hours you put on your application when you submit to that school are the hours they're going to see. So what I mean by that is if you are applying to a school, let's say that requires 1,000 hours and their deadline is December 1st, you certainly could continue to work, wait to submit your application, add the extra 300-400 hours, whatever it is you're waiting for, to your application before you submit theirs. So you certainly can add more hours to your application as you go forward. It's just that if you're going to submit early on for like a rolling admission school, then that matters. And then how recent do patient care hours have to be? I don't think there's any timeline on patient care hours because a lot of people change careers. So I had classmates who were EMTs and paramedics and respiratory therapists for like 10 years. And of course, then they got to submit to school that they worked full time, which is usually 2,000 hours a year for a decade. And so then they had 20,000 patient care hours. So I don't think there's a time limit on patient care hours. Usually the limit is only on prerequisite grades. So sometimes you can't use let's say a general biology course that you took 10 years ago if you're a non-traditional applicant. Sometimes you have to retake those courses. Some schools have it on their website, but I found that most schools accept any hours from the past 5 years. Yeah, that's a good point. Someone made a comment to this. Just checking with your school. But like I said, I had classmates who worked as other healthcare providers, respiratory therapist, nurse, what have you, and they were able to submit their whole career's worth of hours. And then someone said, is 3.2 still a good GPA to apply? Anyone who is meeting the minimum requirements, you are qualified to apply to PA school, right? Sometimes that means you're going to have to make up for your application other ways, whether that's that you have way more patient care hours or you have a really glowing personal statement or you super stand out on interview day. Obviously, a 3.2 in a program where the minimum is 3.2 isn't going to be super competitive per se, but you can make up for that in other ways. So I don't say that to say that it's impossible. Obviously, there's a minimum for a reason, and I encourage anybody who meets the minimum requirements to still apply to PA school. Should we only include shadowing volunteer hours that were completed post high school? Yes, great question. Do not include anything from high school. So essentially from freshman year starting onward, even post-grad years, that is what counts. I would not put any volunteer hours or shadowing when you're in high school. What is the best way to keep up with letter of rec? Is a writer submitting them to me to attach myself? Are they submitting them somewhere specific? What is the best way to keep up with letter of rec for the following year if you decide to push your app to the next cycle? This is an excellent question because it's super confusing. So when you go to submit a letter of rec, you, the applicant, go on CASPA, you put in their name, their email address, I think phone number, a little blurb like about submitting a letter of recommendation from them, and then you give them a deadline to submit it. Then you hit enter, and CASPA emails that person, has them create an account, and then they submit their letter of recommendation to CASPA. So as an applicant, you are completely uninvolved. You will not see your letter of recommendation, and you will not be submitting it. In fact, there's a question on there that says, do you waive your rights to seeing your letter of recommendation? And you always want to click yes, waive your rights. It is very suspicious to say no that you want to see your letters of recommendation. Always waive your rights. So just keep that in mind. Keeping up with letter of rec. This is the hard part. So say you take anatomy your sophomore year, you do great, the professor knows you personally, they offer to write you a letter of rec, you're like, thank you, I'm probably not applying for 2 more years, is that okay? They say yes. Make sure you have emailed them confirming via email, hey, we talked about this in person, you offered to write me a letter of rec, just wanted to clarify that this is the best email contact for you, and if I could have a cell phone number to reach you when it gets closer. Then you have paper trail record or email record of this. Set a reminder with Siri or on your calendar app for 2 years later, right? Or a year later, saying, touch base with my letters of rec. You're going to go back to that email from 2 years ago, hit reply all, and say, hi, just reminding you, I'm applying to PA school this year. We had talked about it 2 years ago. Are you still willing and able to do this for me? If so, CASPA is going to email you with a link to provide my letter of recommendation, and then go from there. This is part of the reason why I tell people to plan to have 5 letters of recommendation, because you could reply to someone on this email and you could get like sender does not exist, email is not active anymore. They could just ghost you. And then you're like, well, now what do I do? You know, my one letter of rec I was planning on hasn't replied to me. So having more people plan to ask is better. But really, there's not a good system. There's no way to store a letter of recommendation. There's no way for you to hold on to it and submit it. You have to just stay in contact with the person. What would be a good resource to find out the highest ranking PA schools in the US and the tuition for each? So ranking for PA schools is semi-irrelevant. Okay. You could Google best PA schools and you're going to get US News and World Report ranking of PA schools. This is not based on merit. Okay. Do not take it with a grain of salt, is what I will tell you. You need to be worried about if the school is providing a good enough education that they are accredited, their students speak positively about them, and they have a high pants rate. You do not need to worry if the school is, ranked 300th in the country. That there's like no such thing as that. So you certainly can like Google and find a list, but that it's not really super relevant. And then the tuition for each usually is listed in each individual's website. However, you can go on PAEA's website, and then they have a directory of every program. And sometimes they give a little succinct summary of their prerequisites, their GPA requirement, their tuition, all of that. So PAEA has like a map of the country you can click on, and then they'll bring all the schools in that state and you can scroll through it. So if you want a one place to kind of look at everything, go to PAEA. Another question was how recent do volunteer hours have to be? I would just say anything from college onward, so nothing from childhood or high school. Do schools that don't have rolling admissions prioritize applicants that were sent earlier? Yes, this is why rolling admissions is so important, because you could have a way greater chance of getting in when all of the seats are still open. So if a class has 42 seats, and they've already admitted 15 people who've paid their deposit, and you don't submit your application for 4 or 5 months later, and they interview you and they're like, well, all of the seats are filled now and you actually made our wait list. Well, that really stinks. So for rolling admission schools, I highly, highly suggest getting in your application as quickly as possible if it's an important school to you. For career changers, previously an accountant, should we explain our decision to change careers in our personal statement? Yeah, I think it's a great opportunity to talk about a career change in a personal statement. And if there's a lot of challenges associated with it, you certainly could talk about it in the life experiences section, or both. I think that it's probably going to be a common question when you're a career changer, especially from one not from healthcare into healthcare. And the personal statement is a great area to do so. Can you reuse a letter of rec as a reapplicant? Yes, but you do the same process. So even if they wrote one letter of rec for you, and you don't get in that cycle, you need to contact them again next year and say, I'm reapplying. Can you resubmit the letter of rec again? They have to make another CASP account and then they submit it again. So you can reuse it, but the process is still exactly the same. Is a fellowship after PA school something you'd recommend, and what are the benefits? Yes, I did a PA school, or I did a PA fellowship after graduating, and I absolutely loved it. It is way too much of a conversation today to talk about it. So like I said, if you go on the YouTube channel for ACT, there's a whole presentation on the pros and cons and the things I loved about doing a PA fellowship. But personally, yes, I'd recommend it. Can you take your prerequisites at a community college if you already graduated undergrad? Yep, definitely. I think sometimes schools take into account the rigor of the class you took. So, for example, taking organic chemistry at your college with a 200-person lecture versus taking or go at maybe a really small community college with 10 people enrolled who always has high pass rates. They will look at where you took the class. So an admissions panel will take into account the rigor of the school. So keep that in mind. However, sometimes you don't have the option to go back to undergrad or go to a college that's bigger based on where you live. So you have to do what you got to do. But just keep in mind that if you take one of those really important prereqs like anatomy, physiology, orgo, one of the higher level chemistries, you just should make sure you take it at a accreditation that shows you it was rigorous enough. Do schools that have a deadline admission date prioritize application that were sent in earlier? I don't think so. That's the point of a deadline school is that they just let you submit them, and then they review everybody equally. So there's no like prioritization, I don't think, at least in my experience of being a little bit involved in the PA school interview process, that they're looking at the date it was submitted. If your PA school accreditation changes from continued to probation with the program up for review again while you're still in school, are you at risk of not being eligible to sit for the PANCE testing? Yeah, this is a really, really complicated topic. There is a blog post on this if you like keyword search it on Google that I usually send all of my mentees to who have this question because it's difficult to articulate. When you get put on probation, you have 3 years as a school to essentially prove what errors you had and fix them. And then if you get off probation, or say your school's even on probation in that 3 years while you take the PANCE, you can still take the PANCE. The problem becomes if they lose accreditation completely, it does ruin your chances for taking the PANCE. It's a little bit more nuanced, but there is a PA blog post that I can look into for you guys and let you know. But you can Google it and find the little bit more explicit verbiage on what happens if you're on probation. Is the cost for schools on websites pretty accurate? Are there typically scholarships or grants given to decrease the baseline costs? So the cost is yes, it's accurate. You're going to get tuition costs and then an estimate for cost of living. Typically, there are not any scholarships to go to grad school. So this is not like undergrad where you qualify for grants, or they offer like, certain tuition discounts. Grad school is a whole different ballgame. You should essentially plan as if you're not going to get anything. Some schools offer smaller amounts, maybe it's like a $5,000 incentive or something. But in the long run, PA school ends up being in the 5 to 6 digits of debt to go to school. There are ways to get your loans forgiven. If you work at a public nonprofit organization, you can do public student loan forgiveness, assuming that will still be in place here in the next decade. And then there are some other health scholarship, like tuition-free programs, but those are extremely, extremely competitive and not that many people get them. So you can look into it, but it's just not common. If I don't mind sharing, did you get in the first time applying or did it take you multiple cycles? I can hear it can take sometimes 2 to 3 cycles to be accepted. So I did get accepted in my first cycle. I think I applied to 13 schools. I I was very lucky that I got in the first time. However, I did plan on applying the year prior, and I just thought I didn't have enough patient care experience. And I was like, I feel like if I apply now, I'm not going to get in, and then I'll just have to do it a second time. So I opted to take a gap year and not apply to strengthen my application. So I very easily could have been somebody who would have had to apply twice if I had done so. But yeah, as PA school becomes, more popular and competitive, I am seeing a lot more second time applicants. So that's why I think people like you guys who, attend a Zoom presentation like this to know how to be prepared can help you be somebody who gets in on the first try. But PA school is getting almost as competitive, if not worse, than med school with an average acceptance rate of 7%. So yeah, it's getting way more difficult. And I often have to unfortunately tell people that PA school is not escape route or an easier option than getting into medical school. So you should want to be a PA for the right reasons. What are good schools in California that I would recommend? Sorry, I have no knowledge on the schools in California if I'd recommend them. I'm sure there's a ton in California. You just have to look into PIEA. Um, if I graduate in December with my bachelor, when should I start applying? So technically the cycle would still be open from the last cycle if you graduated in December. So you'd be applying midway through one cycle, like on the back end, or you could just wait 4 months and apply for in April when the new cycle opens, which is probably what I'd recommend for best chances. What is my best advice to give? My best advice to all of you is to have balance in your life and not become super hyper focused on becoming a PA, which is probably not what you expected me to hear, me to say for this presentation. But you're going to work for what, 20, 30 years until you retire. If you want to be a PA and you have your sights set and you're doing well and you're again, in a webinar learning how to prepare, the time will come for you to become a PA. It will happen. The only person you're destined to become is the person you decide to be. It's one of the quotes that was said to me once. So just make sure you maintain balance in your life. Don't put off fun activities, trips, time with your family in order to get into PA school as soon as possible. There's nothing wrong with gap years, even multiple gap years, to make yourself the best applicant that you can be. For lower GPAs, what's a competitive amount of patient care hours? I think anything that's in the thousands of hours is going to be competitive. Is there anything you would recommend keeping in mind or specifically looking at when putting together a school list if you know that you want to do a fellowship post PA? Yeah, really good question. I knew I wanted to do this fellowship program in neurosurgery, and I knew that they accepted students in PA school. So I actually contacted them and set up my elective rotation in their department. And then I met the whole department and did my neurosurgery rotation with them. And so then they knew me more to apply to their fellowship program. And I definitely think that had a positive impact in me being selected. So being on the ball on what specialty you want to do, asking your school if you can set up an elective at that program, basically maximizing your chances to be selected for their fellowship. It was, again, planning, just being aware of things a year or two in advance. Is physics included in the science GPA? I want to say yes. Thankfully, if you guys go on CASPA's website, they have this humongous chart of every class and the title of every class possible. And they say if they consider it science or non-science GPA. So I actually recommend people going through it and marking down on their transcripts what counts and what doesn't count towards science GPA. But CASPA made a ginormous chart that is wonderful to reference so you're not guessing if it counts. Excuse me. I got a question of how early can you start your CASPA? You can't start your CASPA until it opens. Technically, you could open a CASPA early and put in like your name and contact info and addresses and blah blah blah, which would save you some time. But when CASPA opens, your application resets. So essentially, truly, when can you start CASPA? Like putting in your transcripts and your letters of rec. You can't do that until the day CASPA opens. Don't quote me on this. I think it's the third Thursday of every April is when it opens. So just being prepared. Would you say public health is a good undergrad degree for PA school? Thankfully, your degree doesn't matter. As long as you have a good GPA and you did all the science prereqs, you could have a undergrad degree in whatever you want. Um, Media and communications. I mean, there are people who apply to PA school with a degree in business and then change their mind and got their prereqs. So you shouldn't worry about what your degree was actually, just that you just do well in your prereqs. When schools say that courses expire after 5 or 10 years, does that mean 5, 10 years after graduating or after taking that specific course? It's 5 or 10 years after taking that specific course. So I did recently have a mentee who was like approaching like the 10th year since they had taken a chemistry course. And so they really needed to get in this cycle because otherwise it was going to expire and they were going to have to retake chemistry. So especially in people who are career changers, it's really important to make sure that you're paying attention to when you took those classes and seeing if they expire and planning to retake them if necessary. It stinks. You got to do so much more work when you're a career change person, but being aware of if they expire at 5 or 10 years is really important. What GPA should we aim for? Again, obviously anybody who's meeting the minimum requirements of the school, I recommend you apply. There's a minimum for a reason. But the higher, the better. I mean, you can look at ranges of accepted students, and there are people who are accepted at PA school with a 4.0. Obviously, you grab way more attention with a higher GPA. So in the high 3.5s and above, I believe indicates that you have a B plus higher average. So the higher, the better. We have a few more minutes. If there's any more questions. Okay, a career change asked, can I take an online course to retake a class? Yeah, I think especially since COVID, there's been a lot more lenience and acceptance to taking online courses. Again, sometimes they'll take into consideration the rigor of the course you took. Um, so making sure it's from an accredited institution, and it's the appropriate number of credit hours, and making sure that the school doesn't require like a in-person lab. But one common one I see a lot is people take online medical terminology, and that tends to be accepted. What do PA schools look for most? Uh, that's a hard question. Some PA schools prioritize like people who are in state or people who went to their college or maybe underserved student populations. That's hard. This is why we kind of talked about this as in terms of foundation and framework and the details, because all of it does matter. Some weigh a little bit more heavily than other categories, but ultimately in the end you want to be a really well-rounded applicant overall. How important are the prereq GPAs versus the overall? I think prerequisite GPA is way more important. Some schools will even ask you just to fill out their prerequisite GPA calculator, where you like say they want like they require 7 classes and they'll have you put in their courses for it and they want to see what their requirements GPA is for you. So science and prereq is super important. Obviously, you still need to have an overall, usually above 3.0, but science weighs pretty heavily. What's a good GRE score? Passing. Again, GRE is not like science-based exam. So I just tell people aim to pass that. It's kind of irrelevant. Obviously, you don't want to have a really low in the 10th percentile, but just passing. Someone asked about taking anatomy and physio online, and they plan to take an advanced in person, but they're at a community college. Would that be an issue? I don't think it's an issue. Someone just might take into again, the rigor of a community college, anatomy and physiology course, but a grade is a grade. So if you get an A in a community college, they'll see that and it'll count towards your GPA. The school just might look at you and another applicant, and maybe somebody took the course at a more difficult institution. I don't think it's a problem. What do you take into mind when looking at PA schools and putting together a school list? Do you consider class size, structure, or something specific in curriculum or anything? That's a really good question. I think we all have different priorities. For me, it was like where I wanted to live, like so being near like family and having support. So geographic location was more important to me. I certainly have plenty of applicants who don't care where they go to PA school at all, and they apply all over the country. As in terms of curriculum, PAEA does mandate curriculum minimum standards, so everyone should be on the same page, except for schools might offer something extra, and they'll usually put on their website like, "Oh, we have a focus in community medicine where we do like this free outreach clinic, and all students rotate through there." So some people have like extra things they offer that might be interesting to you, and that's why you'd want to apply there. And then again, class size. Maybe you don't want to go to a PA school that's 98 people and you're more interested in a class size of 35 because you learn better in a smaller environment. So that's your preference. And then lastly, the pants rates. So paying attention to their pants rates. I will not say the name of the program, but there's a program that is technically ranked high on US World News Report, and their pants rates tanked into the 60% this past cycle. So just because you see or hear that someone's a good program, you need to do your own research and make sure that those schools look like they have people passing their boards. How many years does it take your GRE to expire? I don't know the answer to that. I'm sorry. I would have to, I've never been asked that before. I would assume it's in the 4 to 5 year range. Are there some PA schools more well known for a particular discipline in the PA world than others? Yeah, I think there are schools that are super heavy on like preparing you to go into family medicine versus other ones that are like, oh, we don't mind helping our students go into subspecialties. Like I think my program had said they really wanted a focus on preventative and family care, but like most of my class, maybe half of us went into like a surgical subspecialty versus I'm a preceptor for students right now, and the program I precept for definitely focuses on creating PAs to go into family medicine. So they highly value that. Is it a good idea to take other science courses that aren't necessarily prerequisites for a boost? Yep, definitely. If you think you can do well in it and it's going to boost your science GPA, absolutely. If you don't, if it's hard or you think it's going to bring your GPA down, don't risk it. Someone said, so does it five years for a class expired? If you're asking if 5 years is for a class to expire, it depends on the school. Some schools are a decade, so you just need to look. Do you think having research experience will stand out on my application? I get asked this a lot. I don't think that research is as important. There might be programs who um, are more interested if you did research and you can speak about it really passionately, or you spent a lot of time doing into it and it was important to you. I don't think it's something that like I've never seen it required, and I'd never heard it being like a make or break thing. So completely up to you. I do not think research is as important as maybe people applying to medical school. With PAEA regulating curriculum, does that mean all schools have the same structure with the number of classes taken at the same time and number of weeks in each course? No, it's not that the number of time or the name of the classes are the same. It's just that they have, and you can look up the PAEA curriculum standard on their website. You just have to prove that you fulfill all the criteria. So like they, again, they do demand you have a certain number of um, clinical rotations and all those specialties I listed, but like there are some schools that just do 12 months of rotations and some schools that do 15, 16 months of rotations, and you get to do like 3 or 4 electives. So it doesn't mandate like the time you spend in a class or how long a module or a course needs to be. It's just that you get the required material taught to you. If you have a disability, should you explain it or mention your personal statement? I've been given mixed information. Yeah, I think this is a good area to talk about it in your life experiences. And I do believe there's an area to disclose that if you have a disability that's listed on your application as well and the disclosures. So I guess it's a personal preference on how much you think it would impact them being concerned about you being a successful student. Obviously, I personally would say that if you have a disability that you're well managed and you're successful, you should be proud of what you've done and overcome, and you shouldn't have to hide that. probably have time for one more question if anyone wants to get it in. Okay, here's the last one then. What are some ideas that you think makes you stand out when you're writing a personal essay for PA school? That's a good question. I think you should treat it as a creative writing piece, and you're often going to hear show, don't tell. And what I mean by that is you need to have a really like use descriptors and vivid experiences and have a really strong opening paragraph where you want the reader to keep reading. When they say show, don't tell every paragraph a bullet point from your resume. I did this and I learned this. I did this and I learned this. So I always tell all of my mentees to think of it as a creative writing piece where you're going to tell more stories about interactions with PAs or interactions with the patient that impacted you and like how it came to help you make the decision to become a PA. Could you use the life experiences paragraph to talk about how completing your last semester in undergrad during COVID lockdown affected you? You certainly could. However, there is also a COVID section box right now. I don't know how long that will be kept on CASPA. So keeping that in mind for the future, it might go away next year or the year after. But right now there is a section of how COVID impacted you. So you could even just put it in that section as well. So, all right, I think that's everything, guys. Like I said, this will be recorded and posted for you to reference. And if you obviously need anything, you can reach out to me at s.rebey, R-E-B-E-Y, at advclinical.org. Yes, it'll be posted to YouTube for that question.